Hi, I'm Nina Booth, and this is my DNP project reflection. So the first thing that I'm going to say is one of the first things that we were told at the beginning of this. The instructors kept telling us to trust the process. And that's absolutely what you have to do. You have to trust the process, because in the beginning of this project, none of it made sense. I couldn't see how these processes would bring together a completed project that would actually improve patient outcomes and make differences in my clinical site. During the planning phase, it just seemed like all of these forms and tools we were getting together, how were we going to implement all of these things? Trying to understand the measurements and how you were going to measure this and how you were going to measure that. It was so confusing. But Dr. Jefferson kept telling me, trust the process, you're going to be fine, it's going to work out. I just couldn't see how that was going to work. Then you get into implementation and you start the PDSA cycles, and while they're fast and it's overwhelming because everything goes by so quickly, you can start to see, okay, I can see how these tools and all of these things that I've worked on last term are working and helping this project to move forward. And it was really cool to see how making just small adjustments at the end of the last cycle improved outcomes for the next cycle. Even simple little changes like changing the color of a form or bringing coffee with you to a meeting. It's crazy how small little changes made a difference for the next cycle. And then in dissemination, you were able to see your story. You were able to see your story unfold. Seeing a PowerPoint presentation with all the information was really cool. The Squire narrative, it was like writing my journal. And that was really neat. Seeing myself as a leader for quality improvement, me being in charge of a project, and however, working with the team and communicating with my mentor and my sponsor, but I was guiding that project, and that was really cool for me to see myself as a quality improvement leader, and I look forward to doing that more going forward in my career. Also, I feel like everybody at my job is so excited because this project started when my palliative care program was super small. It had just launched prior to the implementation term. Patient census was extremely low, and seeing what this project has done for my program, increasing census and improving access to patients who need palliative care. And everybody's really excited about the palliative care program. It's the only program in our area, brand new. The community wasn't aware or informed on palliative care, what it even is or how it differs from hospice. So I feel like going forward, the improvements that have been made to this quality improvement project, I think people within my job will come to me almost as a consultant or somebody to ask advice for future quality improvement endeavors, and that's exciting. I think that the messiest part of this experience for me was the implementation. It was, I think, because I was still trying to grasp the concept of how everything was going to work, and then getting in those cycles, and they go so fast. And it's hard still at that point to see the big picture. You can see how the cycles are working and the processes are working, but to see the big picture and how the outcomes were going to be. So I think definitely the implementation phase was the most messy part of my DNP clinical. I think I have developed and grown as a person. I've gained self-confidence in speaking in front of other people, other professionals, and speaking to physicians. And even in my professional growth, speaking to patients and having difficult conversations with terminally ill patients and guiding their thoughts and guiding the discussion to help them make decisions. And I think seeing myself as a leader in my field and an expert in palliative care, I think that this project has helped me to gain confidence both professionally and personally. I have made some wonderful relationships through this process, relationships with classmates and connections with those people, but also with other professionals in the field, other agencies, home health and the dialysis center and the oncology center and physicians. And I think these relationships will benefit both myself and my patients going forward. And I'm really super thankful that I had this experience, and I'm thankful that it happened at Frontier Nursing University. And I look forward to more quality improvement projects and hopefully a long, fruitful career of helping patients and improving outcomes. Thank you.